Pet Life Radio.
This is Pet Life Radio. Let's talk pets.
Hello, feline friends. Welcome to Catitude. I'm your show host, Michelle Fern. Today, we're going to talk to an amazing woman who turned a tragedy into something positive for cats and, well, for all pets, but, you know, Catitude. So for cats. And it was through a diagnosis of her cat that she made this decision. So stay tuned. We'll be right back. Hey, Michelle Fern here, and you know saving cats is near and dear to my heart. Did you know that there is an estimated 70 to 100 million free-roaming cats in the United States? And without spay-neuter, that number will keep growing. Not only does spay-neuter mainly reduce the community cat population, but it also keeps cats healthier. Scooter, the neutered cat, is on a mission to give cats an extra life by making it hip to be snipped. Visit his website, GiveThem10.org, to help pioneer a better world for cats. That's GiveThem10, spelled out, TEN.org.
Let's Talk Pets on PetLifeRadio.com.
Welcome back, everyone. I'd like to welcome Jessica Baladad. She is the creator of Feel for Your Life, and she is celebrating 6 years of survivorship from breast cancer. Welcome, Jessica.
Thank you so much for having me. It's a pleasure to be here today.
I'm so excited to have you on. Wow. You know, you received this diagnosis fairly early in life, you know, pretty young. Your diagnosis, well, let's start from the beginning. So tell us a little bit about yourself.
Well, when I was 18 years old and a freshman in college, I accidentally stumbled upon a lump in my breast, and I had it looked at, and the doctor that I saw on campus said, "Hey, this isn't a cyst. This is a solid mass. It needs to come out." And I thought, oh my God, is this cancer? Well, I had it biopsied. I had a lumpectomy. They removed the lump, biopsied it, and it was a benign, non-cancerous tumor called a fibroadenoma, which is something that occurs in women of menstruating ages. And it was that experience that put me in the habit of performing self-exams. Fast forward 15 years later, I'm 33 years old. I had been doing self-exams every month, and I came upon a lump on the left side of my left breast, and it was eventually diagnosed as breast cancer. I went through 16 rounds of chemotherapy, 24 rounds of radiation. I had a double mastectomy, a hysterectomy, and a 10-hour flap reconstruction where they took fat tissue and blood vessels from my stomach and placed them into my chest to recreate my body. And it was all of that experience that inspired me to create the Feel for Your Life app. And that's why I'm here today. It's been downloaded by tens of thousands of women all over the world to encourage them in their breast health advocacy to do self-exams. And that experience turned me into an advocate for my cat, who was diagnosed with small cell lymphoma just a few months ago this year.
Wow, what a story. We're going to talk more about your cat. I'm so sorry to hear that. I applaud you for creating this app because in the U.S., I think the mammogram age is 40.
Yes, it's recommended for women ages 40. I was 33, and we know that 12,000 women under the age of 40 will be diagnosed with breast cancer every year. So self-exams are often our go-to for advocating for ourselves and protecting ourselves.
Yes, and I don't even want to say in this day and age, but I implore women, because probably more women are listening to this, and I think maybe I'm biased being female, but I've had more than my fair share of doctors say, no, this is not right. This is not right. And a lot of us have been told, you know, we don't question a doctor or just confront them. We're taught like not to be confrontagious as women, which is a stereotype, but it exists. It is a stereotype, but it's true. And especially not with doctors.
Oh, yeah. Absolutely. I know when I was first diagnosed, it took me 4 months to get a diagnosis, a proper diagnosis, because I had just seen my doctor for my well woman's exam, and she did a clinical exam of my breast and found the lump and didn't tell me about it because she thought I was too young. So when I found it doing a self-exam, I thought, well, I guess I'm okay because surely she would have told me about this. But it wasn't going away. It was causing me issues. And thankfully, I advocated for a screening and eventually got one and got a proper diagnosis.
Well, thank goodness for that. Let's talk briefly about your app. What is the app about? I mean, I know it's about self-exams, but Feel for Your Life, but it talks about more than that in your app.
Sure.
We're going to talk more about your cat toward the second half of the show.
Yeah, so Feel for Your Life. It shows you how to perform self-exams, lets you track and monitor your progress, and set monthly reminders. And there's also an AI tool on the inside of it where if you get a mammogram, an ultrasound, maybe you have surgery or even lab work, you can copy and paste your results from your online portal into the app. And what it'll do is translate them into terms that you understand. So you understand your diagnosis, you understand your body, and it will also give you questions to ask your medical provider, because sometimes when we're at these doctor's appointments, we don't know what to do or what to ask, and we think of them after the fact. But Feel for Your Life will show you what to do in that moment.
It's a great app. I've downloaded it and very informative, and I highly recommend it. Again, it's called Feel for Your Life.
Yep.
Now let's talk about your cat. So you've gone through all of this, chemo, radiation, surgeries to reconstruct your body. You're doing okay. And then you receive your cat's diagnosis. How did you know something was wrong with your cat?
So he had just gone for blood work earlier this year as part of his routine checkup. Everything came back okay. And that was in early this year, I want to say around the end of February. Well, as it got warmer, it's time to start mowing the grass. My husband mowed the grass. It's part of my husband and my cat's routine. He'll bring in a blade of grass for our cat because he just loves the smells of outside. My cat, his name is Shooter. He ate the piece of grass, and a couple hours later, he threw up, which is kind of typical. We understand it. Hairballs and whatnot have to come up. It's probably why he wanted to eat the grass. Well, he threw up 4 or 5 times within a 24-hour period, and that wasn't normal. And I was concerned about his potassium levels and his hydration, and I thought, okay, this can't be good for his kidneys. He's probably, it can't be good for his heart either. So let's get this looked at. And I mean, it was 2:00 in the morning. We have an emergency vet down the road from our house. And we went there, and I expected them, they'll probably give him fluids, probably give him something to control the nausea and whatnot. But they did imaging on him after his blood results came back a little bit wonky. And they found a thickening around his heart and a thickening around his intestines. And the intestinal thickening is what they were the most concerned with. And that turned into seeing an internalist who did a biopsy and confirmed that he had small cell lymphoma. And, I'm just grateful that my cat was able to demonstrate some sort of symptom that prompted us to go to the doctor, because cats are notorious for hiding the way they actually feel and how they're actually doing. And so I'm grateful for that moment. Yeah, but it was scary, but thankfully it was caught pretty early. It's early stage. It's not very aggressive. We also looked at the thickening around his heart, and we found that he had hypertrophic cardiomyopathy. It's very, very mild. They're not even treating it because it's so mild, but they are keeping an eye on it. So I'm just grateful that my cat showed some symptoms that prompted us to get him the help, because, like I said, cats don't always show when something's wrong with them.
Right. We've talked a lot about that on Catitude, that cats are such stoic creatures and they'll hide what's going on. And you really have to be almost a detective.
Absolutely. Yeah.
To find anything out. That's why annual exams are so important, and paying attention to their habits are so important as well.
Absolutely.
So you're treating your cat with chemotherapy. You're administering it?
Yes, he gets treatment 3 days a week, and because of the chemotherapy that I've been through, I can't let myself be exposed to it. I've been informed that it can be transdermal, and so I have to wear gloves and take care of myself, to make sure that it doesn't, get into my skin or anything. So I wear gloves. He takes it 3 days a week, and just protecting myself and everything. I have to be careful when I clean the litter box. So I got to get my husband's help on that, but he doesn't mind. And so, yeah, that's something that we have to take care of. And he's also on, I call it kitty prednisone, but it's a steroid that makes him so hungry all the time. And he runs around the house all day, all night. He's got so much energy. You would not know my cat has cancer based on the way that he's acting right now.
And what is the prognosis? I mean, you have to wait for the chemo, but since it was caught early, the prognosis is pretty good.
Yeah. Yeah. He's got a good prognosis overall. All this medical stuff, the terminology, it is so much for someone to keep up with. Yeah. So his prognosis is looking good. He will probably be on this for the rest of his life, primarily because he's a 15-year-old cat. And it's possible something else could happen between now and the rest of his life that isn't contributed to the cancer itself. So when I take him for checkups, we go quarterly right now, every 3 to 4 months. We get, labs, we get chemistry work done on him. I'll ask for urinalysis and extensive tests on his urine as well, just to check his kidney levels, liver, stuff like that.
All right, we're going to take our midway break a little bit earlier this time because we're going to talk a lot about some other things that you're working on that are so important, which is as an advocate for pet health insurance and for financial plans for your cats. So we'll be right back.
Take a bite out of your competition. Advertise your business with an ad in Pet Life Radio podcasts and radio shows. There is no other pet-related media that is as large and reaches more pet parents and pet lovers than Pet Life Radio. With over 7 million monthly listeners, Pet Life Radio podcasts are available on all major podcast platforms, and our live radio stream goes out to over 250 million subscribers on iHeartRadio, Odyssey, TuneIn, and other streaming apps. For more information on how you can advertise on the #1 pet podcast and radio network, visit PetLifeRadio.com/advertise today.
Let's talk pets
Let's talk pets
on Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
Welcome back, everyone. We're talking to Jessica Belladad. She is the creator of Feel for Your Life, which is an app for women to check the girls once a month. And this half of the show, we talked about your diagnosis, and I'm so glad you're in remission. You're taking care of your cat. And since then, you've become such an advocate for pet insurance, and also so that pet parents consider the financial burden of their pet's health. So tell us about that.
So whenever you get a cat or a dog, you have to think about the financial responsibility. And I know people hear that and they just kind of roll their eyes and yeah, going to take my pet to the vet. But pets have genetic issues that show up, not always early. It could be in their midlife or later in life. And when you have pet insurance, the way that it generally works is you don't really have a deductible that you have to meet most of the time. In my experience, it's you go to the vet. If they don't have a pre-existing condition, you pay for it up front and then you submit for reimbursement. And I think just having that safety, because cats in the young age and the older age, cats at young ages, they're exploring things with their mouths, they're getting into things. You're trying to figure out what are they allergic to potentially, what could poison them or harm them. Cats are so unpredictable with their behavior. Dogs are a little bit easier to train, but again, they chew on things and do things that are often unpredictable too. You never know what's going to happen. And this is a companion, someone you're bringing on into your family that you want to be part of your family for as long as you possibly can. They can't live forever, and humans most often live longer than their pets, but they're part of your family and you want to protect them, and they are an investment. Well, they're not really an investment.
Well, kind They're an investment in joy in your life.
Yeah, that's true. That's definitely true. I'm
It's like your health is an investment too,
Right. Yeah. But, they have their health liabilities as well. But you invest in your pet because you love them and you care about them. And I think pet insurance is a great option for people who, may have an animal with special needs or may have issues down the road. If you protect them up front, then you know that you feel good about what you're putting into your pet.
So let's talk about pet insurance. I know some companies, quite a few companies are offering it, just as they offer health insurance. And some of the costs they're not that high. More and more veterinary offices, whether they're private practice or, larger practices such as, I'm not as familiar with Chewy Vet Care because that's fairly new, but, I know VCA has its own thing, but I know that a lot more places are accepting pet insurance, but yes, a lot of them are. Do you find that a lot of them are more of the type of insurance, you pay a monthly or quarterly fee, but you pay up front and then you're reimbursed?
Yeah, that's what I typically have worked with in the past. Yeah, you have a little bit of a premium, which is more like a subscription, something that you pay for monthly, and they collect fees off of that. And that way, whenever you do have an issue, usually if it's not a pre-existing condition, they'll reimburse you for it. And, read the fine print and all of that and make sure that you understand what it is that they do and don't cover and that. So you're not caught off guard when you're submitting receipts to be reimbursed, that if they get denied, that you're just not left in the dark with that.
Okay, so let's talk about the other part of that, which is your financial responsibility as a pet parent. And this is important because I think if you don't keep that in mind, that there's financial responsibilities other than buying the fun stuff, food and treats and toys and, for some clothes. There's also the other side, which are annual vet visits and special things that come up. You need to have a plan. And I think that is one of the reasons, and just from learning from guests I've had on the show, that's a large percentage of why pets that are adopted are brought to shelters, because people don't keep that in mind, that there's going to be that financial obligation.
Right, exactly. And you think about, surgeries that your pet may have, not just getting fixed, quote unquote, but other issues that may come up in the future if they get cut or hurt or get into a fight. You want to know what options and choices that you have ahead of you. For instance, there's the cone of shame that a dog or a cat may have to wear so that they don't lick their wounds. However, there's a product out there called Caravet that you can actually place on the wound that deters the pet from licking themselves. And then when you're making these decisions and, you've got these financial responsibilities, if you have that pet insurance that can help you with that, you don't have to second guess yourself when you're making the decisions that are best for you and your pet and their recovery.
Well, I like the idea too that if you, for some reason, you don't have pet insurance or you have a pre-existing condition with your pet, that you have a plan to set aside money. Have that plan. I've had with my dogs in the past, where this was at our vet, which was VCA. I used a different one in Los Angeles, and they have something where you pay a certain amount per month. It includes dental and includes, checkups and a lot of the basic shots. And I was fortunate that neither of my dogs were sick. Minimal. I mean, I did have a couple scares, minimal. Cats, I did have one of those surprises with Dennis because, as we talked about, cats are stoic creatures. Dennis, I wish I had known this sooner because the poor little guy was suffering, but he had crystals in his urine. And at that time, and we're going back, Dennis was, we might be going back like almost 10 years. So that was almost $3,500 10 years ago. So with today's inflation, that would be what, 7,000, 6,000?
Something like that. Yeah.
If you're not prepared. And then you also have to, I took him to one place and they said, well, his potassium levels are high, just put him down. And we're like, no. So it wasn't VCA who said that. My VCA vet, and they took care of him, and he's Maine Coon, so he made friends with everybody. They said, we want to keep him a couple extra nights. And I said, I didn't really budget for that. They said, no, it's on us. We had so much fun with Dennis. But I've told the story a few times on Catatoo. But the thing is, luckily I had savings. And it was 3,000, which wasn't, sometimes you can get a real shock. Oh, it's 10,000, 15,000, which is something most people aren't prepared for. Not even 3,000, most people aren't prepared for. And the other thing was the fact that I caught it in time.
Yeah.
What do you say to those people that are listening now that, oh, I want a cat. It would be such a great enhancement to my life. And they have that and they're thinking, how can I be financially prepared? Or those people that have maybe cats are like potato chips. As Bernadine Cruz, one of our show hosts, says, you can't have only one. So most of us have 2, 3, 4, 5 cats. And they go, how can I afford pet insurance for 5 cats?
I think you really have to have an honest look with yourself and say, hey, this is a life that I'm bringing into mine. And this isn't just some commodity or just a thing. This is a life that you will be part of for their entire life. It's like that saying, a pet is part of your life, but you are their entire life. And you have to think about what kind of care that you're going to be able to offer to that pet for the longevity of their life. I live in a military town and I respect our military, but so many times I see in Facebook groups, hey, we have all these pets and we're getting ready to PCS somewhere else. And we're not able to, and that means that they're locating somewhere else. And we're not able to take all of our pets. And so we're giving, a couple of them, all of them up for adoption. And it breaks my heart because that military family probably didn't think about that when they initially adopted those pets or when they took on those pets in their lives at their current duty station, because a lot of these military families are young and, they just want to have the normal of a life as possible, and pets are part of that. So it's just sad and breaks my heart when I see that happen sometimes. And thankfully, the community that I live in is very supportive when it comes to issues and instances like that we do have nonprofits that can support those animals, but it's becoming an increasing problem. And I think you just really have to take a look at yourself and understand your obligations and your responsibility to a life that you're going to have and bring into your home.
That's a great point. And I can understand the military point of it because sometimes people are deployed overseas and quarantine situations can be difficult or based on what, the country's rules are with that. But I agree, though, you have to think of things long term. If you can't afford the cost of your pet long term, including all of the healthcare responsibilities, there are things like cat cafes. You can go to a shelter and volunteer. So you get your, feline fix that way. There's shelters for dogs too, but more catitude. But there's other ways you can do that. What would you advise for someone who says, I'm not going to do pet insurance because I had some bad experiences, heard some bad things. Although I would really encourage people to get out there and look. It's changed a lot. I remember first hearing about pet insurance. Wow, like more years than 25 years ago. It's been around a long time and it's evolved. But what about for those that are going to say, I'm going to be more financially responsible? What would you recommend as far as a goal, dollar-wise?
Dollar-wise, I mean, it depends on the cat, the breed that you're going to get. Do research into how much it costs to care for that cat. How long could they possibly live? The potential issues that they could have. They actually have genetic tests out there now that you can have your cat take, and that will kind of give you an insight into the issues and problems that they may have medically with their health in the future. So you can kind of use those things and decide, hey, is this breed of cat what I'm willing to take on, and will I be able to save responsibly? Because if you get into a situation where you have to go to like the emergency vet or something, and the cost can be astronomically high sometimes, they do have option like for care credit, but my understanding is that the interest rates are just insane. And you really don't want to get caught up in a situation where you could go into like lots of debt and it's just not good for you, the pet, or anyone. So I would just say do your research about the breed and decide if that's the financial obligation you're willing to take on.
I absolutely agree. In all of your research that you personally have done, do you have a dollar amount as a goal? So should people save? I know it can vary so much, but to just give some people an idea, have at least a couple thousand in savings for your pet, just in case. I do know from experience that emergency vet hospitals can run easily for a visit. I mean, $400 for just blood work to maybe $1,800. A couple thousand for an emergency vet visit, depending on what the situation is. So what would you advise just as your suggestion on a dollar amount?
If it were me, and this is me personally, and I did have this set aside, I had $5,000 set aside.
That's what I was going to say, because you need a good chunk.
Yeah, that went very, very quickly. I'll just say that. But I'm glad that I had it and we were financially prepared.
And for those of you that are thinking, oh my gosh, how in the world can I save $5,000? That is so much. You know what? Do it all of those financial places. If you haven't listened to any financial people or did any work, you should. Think of where you can cut out money. I have nothing against any coffee place or going out to lunch, but your $5, $6 coffee a day habit can be $300 for the month saved. Easy. Do you run into this when you're having, talks about people like, where can I find the money? Everything's so expensive these days.
I have run into people in different Facebook groups with the small cell lymphoma group that I'm in for cats. And sometimes you may be able to find a nonprofit. Let's say that you have a cat with diabetes. There may be a cat diabetes foundation that has an allotment where you can apply for funds. There aren't very many of them, but I have seen them go around in different Facebook groups.
That's a good option too. I always think you should start with yourself to see how you can, if you're not a saver, change your lifestyle a bit so that you are a responsible pet parent for your cat. Should your cat, get ill, or should there be just an emergency? Because that happens too. But there are a lot of wonderful groups out there, and there's more and more out there, which just says a lot to where we've come to how much we love our pets in this day and age.
So there are some tips that I have for anyone who wants to advocate for their cat effectively at the vet. And this actually coincides with what I advocate for in the breast cancer space as well. Number one, find a great doctor for yourself, and you're going to find a great vet for your cat. Number two, do your self-exams. And you can do that by downloading the Feel for Your Life app. On your cat, we know that you pet your cat, but you also kind of want to go thoroughly under its belly. On occasion, we know that cats don't like to be rubbed there or touched there, but you want to actually feel for anything, any lumps or bumps or abnormalities, because mammary cancer is a thing for female cats. And then genetic testing. You would do it for yourself if you wanted to know about your genetic disposition to cancer or disease. And they also make those for cats as well. So those are my 3 tips for advocating for yourself and your cat whenever you're going through a medical issue or situation.
I want to thank you so much for coming on Catitude. Can you share your app once again?
Sure. It's Feel for Your Life, and it's available in the App Store or the Google Play Store. And you can also find it at feelforyourlife.com.
I want to thank you so much for coming on Catitude. I'm so glad that you are in your 6th year of survivorship. I hope your cat continues to do well.
Thank you so much. I appreciate it.
I want to thank everyone listening to this episode of Catitude. Very special. Be sure to check out the app Feel for Your Life. That saying, the life you save may be your own. So very important for all women and for men, because it does affect a small percentage of men, breast cancer. I want to thank Jessica for her information and advice on pet health insurance, as well as suggestions for being financially responsible for your pet. Thanks to everybody listening to Catitude. I am so grateful for your listenership for all of these years. Thank you so much. And of course, thank you to my cat crew, Dennis, Charlotte, and Molly. I do have funds set aside for you, but I hope you stay nice and healthy. And this show would not be the same without the magic work of Mark Winter. Thank you, Mark, for all you do. And remember, lose the attitude, have catitude.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.